Welcome. Today we are going to talk about a basic manual muscle test, or a neurologically locking muscle. So the basic concept is all muscles are able to be facilitated or turned on in a general sense. They should all turn on and have a nice neurological lock. So if it's okay, Tim, we're going to check that for you. So you're just going to go ahead and push up, just match my pressure here. So this is not an arm wrestling competition. Either Tim will be nice and strong like this, or his muscle will be kind of strong but mushy, kind of a mushy muscle. Now, we have a point that we can actually press here on the forehead to check and see, a polarization point that tells me that actually shuts that muscle off. You can kind of see it's strong, it's still holding there, but it's kind of mushy, right? So then we take that off, go ahead and push again, and this is nice and neurologically locked. Now, we can use this idea of manual muscle testing in anywhere in the body, but specifically for testing purposes and making this relatively quick, we're just using this arm. Now, the concept behind, additionally, what we use in the office is we use this cool little poster here. Okay, as you can see, we use the basic idea of life is an atom. An atom has a field around it. So that field emanates around this particular atom. We see fields in nature as well. Small ones, big ones. Okay, so generally speaking, if you come into the office, you probably have one of these, a small or an imbalanced field. Now what we want is we want this healthy, big, and strong field, and that's going to be representative of a healthy person. Now the manual muscle test is going to allow us to interact with Tim's field, right? So for example, what we're going to do is we're going to just check a couple of different points, and we're going to see how the body turns on and off when we check different circuits, right? So for example, I know there are a couple of body points off on Tim. I'm going to just show you what it looks like for a body point to turn off as well. So arm up here just like this. Again, what we're looking for is muscle is nice and strong in the clear. And if there's a body point that's off, like a body pain or some sort of other health issue, generally speaking, the body is going to turn off. So you can kind of see here, if I apply any pressure, this shuts off whether Tim likes it or not. And he's a pretty strong guy. So this is me applying that same pressure, and that stays on. So this is a basic example of what a manual muscle test looks like, as well as some of the ways in which we interact with the body, and we work towards getting you to that big and balanced field. So we'll talk to you soon. Dr. Fisher and Tim, signing out.